Columbia Morning on News Talk 1400 KFRU. I've, over the years, always enjoyed my visit with Dr. Joel Shenker, who's in the studio with me. He's a neurologist and works over at the University of Missouri Healthcare. Dr. Shenker, I don't have all of your credentials in front of me today. I apologize.
No, that's fine.
So this is, and I saw this also from somebody who works with the Alzheimer's Association. June is Alzheimer's and Brain Awareness Month. And so one of the things that we could talk about is what's happening new as far as ways to ward off the impact of dementia or Alzheimer's.
So increasingly there's research to try and understand, are there things that we can do really throughout our lifetime to make it harder for a disease like Alzheimer's disease to evolve? So there are studies that are currently ongoing and starting to produce some fruit that tell us what are some of those things. One simple thing is to control blood pressure. So a study released last summer, which is being expanded and continued, showed that even more aggressive ways to reduce blood pressure than we ever used to do before have the consequence of making it much less likely that people evolve into things like mild cognitive impairment and dementia. So some of the things that you already should have been doing for your general health are things that might also be beneficial from an Alzheimer and dementia point of view.
I think I have those things in my mind. Don't smoke.
So it's all the stuff your mother would have told you to do.
Eat well.
Right.
Exercise.
Right.
Those are 4 biggies.
Yeah, staying mentally active, staying physically active, good sleep hygiene, a diet that's rich in fresh fruits and vegetables, not being a smoker, probably limiting alcohol, the control of blood pressure. These are all things that we have good reason to think make it less likely for a dementia disease to evolve.
Let me ask this question, and then we can get into some more of what you just said. But it seems to me like it's really hard to do any kind of research on Alzheimer's or dementia because you don't know who's. I mean, how can you predict? Can you predict when somebody is a teen or 20 or 30, whether that person is going to have a dementia problem?
So this is also a very big, active area of research right now. If we look at Alzheimer's disease specifically, which is only one of several diseases that cause dementia, Alzheimer's is a very slow-moving disease. And by the time you have symptoms from it, you've had the disease for years, probably decades. So just as you're asking, there's a lot of effort to say, well, gosh, are there ways to have a marker, a biomarker of the disease process we call Alzheimer's disease? In a study concluded about 2 years ago that we participated in and several places around the country did, it was established that we can use a brain scan, a type of brain scan, that tells us if you're starting to show deposition in the brain of one of the 2 neuropathology hallmarks of Alzheimer's disease, something called amyloid plaque. There are also ways with blood tests that are evolving with research, and we've already been able to do it with spinal fluid lab tests to establish if some of those chemical changes are occurring in the brain. And in theory, we can start to get these kinds of biomarkers well before people have symptoms. The problem is we don't quite know what to do with that information. So if a 50-year-old who is not yet showing any signs or symptoms has some of the biomarkers of Alzheimer's disease, what we don't quite know is, well, what's the likelihood that that person will go on to show the symptoms of it, and when would that occur? But by having these biomarkers, we can start to do some of that research and answer some of those questions.
So biomarkers are a pretty definitive way of saying somewhere, if that person lives long enough, they're going to have Alzheimer's or some form of dementia.
That's increasingly where the field is going, to have markers of this disease before you're symptomatic, and then do research and other clinical interventions to try and stave off the evolution of the symptomatic progression of the disease.
There are some people that would, you'd say, lived a healthy life and started living that healthy life really early on. Maybe they really took a great concern of it when they, in their 20s, they said, I'm always going to eat right, I'm going to sleep, I'm not going to smoke, I'll limit my alcohol, I'll be physically and mentally active. And they can still, though, have Alzheimer's.
They can. So I don't know if your listeners will remember Jim Fixx.
Sure.
Jim Fixx was a runner, and he wrote a book about running in the 1970s. It was a big fad. And before that book, I was a kid, But I remember that, gosh, no one would go running just for the heck of it. They would be, track and field events, but that's it. And Fix initiated this big fad about running. It's an exercise. It's for all of us. You don't need any special equipment, a good pair of shoes, and so on and so on. And Jim Fix died. He had a heart attack and died. I think he was in his 40s. And the comedians and the late night talk show people said, running's not so good for you. But the backstory is that all the men in his family died young from early onset coronary artery disease. He had family members that died in their 20s from heart attacks. Fix died in his 40s. So by running, he probably did help himself, but only relative to the hand he was dealt. So the smart things. I see
what your point is.
Yeah. So the smart things that you're describing are smart. You should do them.
Mm-hmm.
But that's not a promise. You're never going to get Alzheimer's disease or another dementia-causing disease, but it's the smart play. The best way to make this not likely to happen or to happen later than otherwise is to follow these kinds of steps.
Are there guidelines into how much exercise or what kind of exercise is best for someone who has this on their mind to say, I want to stave off any kind of dementia as long as I can?
Purely with respect to this topic about staving off dementia, it may not take a lot of exercise. A gentle walk, 15, 30 minutes a day, or a couple of times a week, makes a difference in research on people who go on to be followed for cognitive decline. So if you want to spend 6 hours a day in a gym, be my guest, but even regular, gentle exercise that's not beyond what most of us can do makes a difference.
Now, does it also matter whether maybe you've already got early onset? Could you start exercising then? Yes. Does it slow down the process? The researchers
Yes, much of the research that establishes that these are valuable things to do are in people who are, in fact, already showing at least mild severity signs of these diseases, because otherwise the researchers don't know who to study. So one of the most common research setups right now is to find people who are only mildly affected by their dementia disease and try and intervene. And what we find is even while people are starting to show symptoms, interventions can make a difference in terms of what the next several years may contain for them.
Hold up a pair of headphones right there because sure. I do have a caller and they probably have a question or comment for you. Did you want to have a question on this issue? Caller, good morning.
I do. Good morning. Is Alzheimer's hereditary? And the reason why I'm asking this is I know a family where two brothers have died, a sister, and one brother has it now.
All right, keep listening, and we'll answer that question. That's always a good question to ask. What's the
good question? Common question. Mm-hmm. First of all, there are several diseases that can cause dementia. Everyone knows about Alzheimer's, and it's certainly the most common. Some of the other dementia-causing diseases, which can look kind of similar, have a greater chance of being spread by a genetic or hereditary mechanism. And so that family might not have Alzheimer's. They might have a different disease that causes dementia. Alzheimer's itself mostly is not thought of as an incredibly strongly genetic disease. There's a small percentage of people, maybe 1 or 2%, who have a very strong genetic familial form of the disease. But for most of the rest of us, Alzheimer's disease is kind of like a lot of other diseases that we know have some amount of heritability. For example, if both of your parents had heart attacks and died in their 50s from heart attacks, that's not a promise you will too, but it sure does make you want to be much more aware of that type of disease process and do things to intervene. So generally speaking, if you have a first-degree relative, generally speaking a parent, who had a dementia-causing disease, especially if it was at a relatively younger age, in their 70s or earlier, that would be a greater concern. But in most cases, it's not a deterministic risk that it must be that you're going to get the same thing.
What should we leave people with this morning?
Well, I think it's important to point out this is a really common type of problem, and it's a problem that has a lot of potential for a lot of symptoms, but it needn't be the case that these produce terrible problems for the person in terms of their everyday routines. What we need to do as a culture is to start to be willing, as we're doing today, to talk about this. There's a recent study that shows about 9 out of 10 dementia patients or patients who are just elderly would like for their families to tell them if they thought someone was cognitively impaired. But at 75% of families say they don't know how to do that. So to me, it's a hopeful thing that if we can get together and start talking about this, sharing our thoughts, making sure someone is in a safe situation so their memory loss can't hurt them, we will all be better off. That's something that we can do. Even in a person who succumbs to a dementia disease, their future can be better than it was going to have been by families and friends and communities pulling together.
Practice healthy lifestyle, mentally, physically active, and some of the other things we talked about in regard to smoking and drinking alcohol and sleep, and then ask somebody to go out for a walk with you and take up this subject. I mean, that's what you should do. I mean, you can do that. I mean, sometimes walking, I saw this with adolescents, walking side by side, it's easier to go into these kinds of topics than it is face-to-face sitting down. Well, let's sit down at the kitchen table and do this. No, let's go for a walk and we'll talk about this. What do you think about this? I asked them to, do you think I'm starting to show signs of memory loss? Do you think I'm starting to not be able to take care of myself like I have in the past? Am I having some thinking problems that you've noticed? And walk and talk.
Just starting the conversation. So many of the patients I see and the families trying to help them struggle with the fact that they just don't know how to start having conversations about safety, about other things. And part of the problem is they've never tried. And starting that when the person that you're trying to help is 87 is a bad time to start. So start now.
Doctor, thank you. Pleasure. Always good to talk to you. Dr. Joel Shenker has been our guest. It's News Talk 1400 KFRU.